Good afternoon, everyone. Welcome back. We are going to start our session 4 on sustainability, climate change, and public health. My name is Sofia Viegas. I'm the Deputy General Director of the Instituto Nacional de Saúde, in English, National Institute of Health of Mozambique, and I will be the moderator for today's session. So, we will have 1.5 hours, and we are going to have a presentation about the work that the IANPHI Climate Change and Public Health Committee have been doing on, and then we are going to have 4 presentations of the member institutes where they are going to share their experience. Now, to start our session, I will invite Professor Amir Ikram, IANPHI Executive Board Advisor, to give the introductory remarks for this session. Thank you so much. Dr. Amir, please.
Thank you so much, Sophia. I think delving into a very, very important subject, I would start with the words that I think climate is the evolving checkmate. Where do we stand? There's a huge global warming, rising temperature, wildfires, unexpected rainfalls, heavy rainfalls, inundations, floods, hurricane, what and what not. So it is definitely a global health threat. Now, moving on, as we discuss this thing, there are bodies in the world which are very much concerned, and I think IANPHI has a pivotal role, and it recognizes this, especially the climate action, as increasingly important to deal with such calamities. And definitely, if you talk of different determinants, whether environmental or socioeconomic, that are directly damaging the mental and the physical health. Now, if we go back slightly, in 2015, the World Health Organization pays a lot of praises for the Paris Agreement, and talking in particular about the climate and its effects on health, especially the mental health as well as the physical health. The climate change, the biodiversity loss, and especially, I think, Earth's supporting systems, life supporting systems, talk in terms of what is going on and how this is the right time, how we deal with them. As we all understand that the National Public Health Institutes are the cornerstone for public health dealing. And I think climate is one of the key areas which is under now huge consideration. So IANPHI in 2021 did a survey of different countries. And we did realize that there was mapping, and there were definitely addressing certain issues related to climate were the concern. But most of the NPHI still didn't recognize that they were the key stakeholders in that. And only a very few out of them were basically having some robust plans and funding as a key stakeholder to deal with the climate-related calamities. And in turn, definitely, we talk of climate mitigation and adaptation, which are the foremost in this regard. Now, keeping that in mind, a roadmap was published by IANPHI the same year, which wanted to engage the different NPHI stakeholders into loop so as to talk about the human well-being, the physical and mental health, and take them along. And there were certain key strategic objectives that were laid down. As we moved on in 2022, IANPHI again published certain linkages related to the Public Health Institute versus the climate change in the Lancet Global Health. And I think these are the things that so many directors sitting over here, I must sensitize, I want to sensitize them that they need to pick it up from here, take it on back to their institutes, and make sure that they do address the climate change related effects, talking in particular of mitigation and adaptation. Now again, as IANPHI has been playing the leading role, we did see that some time back a working group was constituted, and later on it was converted into a thematic group, which is chaired by Professor Sebastian Dennis. And it would be great to hear from him today as he delivers his talk about these concerns as we are talking about. And extremely grateful to the whole group that is available online. I myself being part of that group, I think they've done a great job in this regard. But I think as you move on, it's, I mean, preparing such documents is one aspect. The actual true ground implementation is the major aspect, and that's what we all need to do together as a family. And I always regard IANPHI as a family, and we can take this along and along. So I think, I'm sure the message will be delivered through this group to all the NPHIs and all those who are not prepared as we move on. So we do expect some excellent presentations, and I would like to now hand over back to the moderator to move on with the session. Thank you so much.
Thank you, Dr. Hamir, for these motivating words. I will now invite Dr. Sebastian Dennis, the Director of the Environmental and Occupational Health Division of the Santé Publique France and Chair of the IANPHI Thematic Committee on Climate Change and Public Health. Dr. Sebastian will be presenting online.
Hello, can you hear me?
We can hear you.
Perfect. I'm very happy to be here today, even if I wish I was with you, but it was unfortunately not possible due to other commitments. So I will share my screen and give you an overview during this presentation about the work. So I will try to use my screen or not.
We can see. Can you please put on slideshow?
Yeah. And now?
It's working.
Is it okay for you?
Yes.
Okay. So, and indeed, I will give you an overview of the work of the committee, IANPHI's Committee on Climate Change and Public Health, that I have the honor to chair. And we also now have, since last month, a vice chair with Dr. Maya Luz from Cabo Verde. First of all, a first reminder about the links, but even if I know that most of you know the links between INPH's climate change and IANPHI, but I thought it was very important to remind you that climate change has a lot of impacts on public health, and in particular on physical and mental health, and environment. And of course, the quality of environment drives the good health and good well-being of human. Despite these huge impacts, these impacts are really a great opportunity to improve public health because of the co-benefits of climate change mitigation and adaptation. So this is really recognized by several medical publications in the Lancet, for instance, but also by other communities which are more involved on the environment field. So you have to keep in mind that climate change, environment, and good public health are really connected. Due to their missions and positions at the cross-sector of different sectors, ministerial sectors, and at the science policy interface, national public health institutes are key actors to tackle climate change issue. And due to their multiple relationships and their leadership in terms of public health actions such as surveillance, monitoring, prevention, or orienting researches, NPH is really at the center of the actions regarding the climate change issue. Then IANPHI, one of the reasons that IANPHI included climate change as a top strategy in its action plan from 2021 to 2025. The committee that I share on climate change and health is really a recent story. It started, as the introductory words related it, from an informal working group on climate change and public health in 2021 that was transformed into a IANPHI standing committee in 2022. This story started with a survey as it was already related by Professor Ikram during the introduction. Survey that was conducted between April and June 2021. So survey that was done among the IANPHI network, and we received 33 INPHE's answers on this survey. The survey was really on the perception of the different INPHE on their role and their organization regarding these climate change and health issues. So this survey demonstrated or showed that numerous NPHEs are already engaged in the climate change and health activities, but very few are considered or considering themselves as key climate actors, and very few have the necessary resources to tackle all the dimensions of the climate change and health issues. However, all of the national public health institutes that answered to this survey were aware about the important role to play to promote cross-sectoral approaches on climate, biodiversity, and health, and to develop international collaborations. So that's why we decided to create this Committee on Public Health and Climate Change. And we try to, inside this committee, develop these activities. Of course, first of them centered on capacity building and sharing of practice and experience on the climate change and health issues. Then on the publication of different formats of documents or webinars to advocate inside and outside the INPHE's network to prove the efficiency of these institutes to be real key actors in the climate action, to write together different common positions on specific themes, of course contributing to the dissemination of the work we are carrying out. And to do that, we try to meet once every 3 months, and we also have some specific subgroups. For instance, we have a subgroup that is working on indicators that the INPHEs can produce on climate change and health issues. And we also have another one on extreme weather events and the role of national public health institutes to face these extreme weather events. You can see here the participation of the different countries into the committee. So we can say that we have a pretty good participation, even if our goal is always to improve this number of participants, and focusing also on the balance between high income countries and low and middle income countries, because of course we are all faced to the problems of climate change, but we are not faced to the same issues. And then it's very important that in this committee we can have the wider representatives of the different countries all over the world, and so that we would like also that this presentation today gives you the opportunity to take this message at home and maybe advertise for the committee. So one of the first work of the committee, and I would qualify it as the launching work, was this roadmap on engaging and supporting national public health institutes as key climate actors, that revealed the untapped potential of national public health institutes as key climate actors. This roadmap was launched during COP26, so we had a special session under the WHO pavilion, and after we had this short communication in the Lancet Public Health to sensitize the public health community about the role of national public health institutes on this issue of climate change. In this roadmap, we describe different IANPHI's commitment to improve climate change and public health interventions, acknowledging the fact that what is mentioned in the Paris Agreement regarding the necessary limitation of the increase in global average temperature to 1.5 degrees and protecting biodiversity was essential to the health and well-being of current and future generations. We also stated, and we're strongly committed to advocate on the fact that national public health institutes are real actors and have to promote climate action, because actually climate action is a true and very efficient public health action, will have also benefits on human health. Then we were also at this time in the context of recovery from the COVID-19 pandemic, and there again this pandemic offered an unparalleled opportunity to consider these aspects. Then we also advocate, of course, as in other sectors, to promote health in all climate policies and climate in all health policies, and that we recognize that climate and health benefits from actions on food systems and diets, limiting air pollution, access to clean water, etc., etc. So I know that this IANPHI's annual meeting is really centered on the essential public health functions, and in this roadmap, we also insist on the fact that actually the fact that INPH's work on climate change and health issues is really online with the different essential public health functions that they should develop. If you see this scheme, you see that three categories of essential public health actions are at the center of the action in terms of climate change. Monitoring and evaluation, so it means that we, as NPHE, monitors the impacts of climate risks and their impacts on health. Cross-cutting climate and public health research, measures the benefits of nature-based solutions, so which makes the links with biodiversity and quality of our environmental resources. So it was under the umbrella, those one were under the umbrella of monitoring and evaluation. Another category of essential public health function are around response and facilitation of the action, with gathering the evidence-based advice to policymakers, also facing to extreme weather events, and multidisciplinary based interventions. And then the third category of essential public health function that is at the center of this overaction, climate change and health, is around protection, promotion, and education, because we have a role in educating health workforce to climate issues and health risks, advocacy and public outreach, and then promoting healthy environments and lifestyles. With this committee, we have a lot. We had a lot of dissemination activities, because we try, of course, to be active and present when possible in the different political events that are related to climate change. So, as I mentioned, we were present at COP26, at COP27 as well, on a side event on the indicators and the regional action. We were invited also to present the committee and IANPHI's activity on climate change and health at the last European conference organized by WHO on environment and health. So it was last July in Budapest, Hungary. And of course, we also, maybe some of you know that already, but we organized under the French presidency an event entitled Health as a Lever for Action on Climate Change. That is, this title perfectly summarized the spirit in which we are in this committee. And then we are also, thanks to the very active role of our German colleagues in this committee, we also were related into the statement of the G7 health ministers in 2022. Beyond these political events, we are also really involved in the scientific, at the interface of the scientific community, much more broader than just political, linked to the politicals. We try to systematically have a symposium at the European Conference on Public Health, and we also organized our own webinars. We had so far one webinar organized in 2022 on indicators. So this webinar was organized by IANPHI and associated different partners of the ecosystem. So for instance, we invited the Lancet Countdown and the European Observatory on Climate Change and Health. and other colleagues from other parts of the world were also associated to this webinar. Another important issue is to develop the collaborations with the ecosystem, because you remember, but I said that we are at the center of an ecosystem, and so we should also develop and implement collaborations with different partners. So this year we launched a very promising collaboration with the European Climate and Health Observatory. Of course, we need also to develop the collaborations with WHO, because there's also a memorandum of understanding between IANPHI and WHO, which is a real opportunity. So we need to work on the development and strengthening of collaborations on these issues. And recently we met the World Meteorological Organization, so we think that it will be also very useful and important that IANPHI thinks about a memorandum of understanding with WMO, but of course we need to discuss that with the board of IANPHI. And ASFER, which is the Association of Schools of Public Health in the European region, is also part of the committee. Coming soon in 2024, so coming soon a paper on extreme climate events and the role of national public institutes, because as it was said in the introductory words, we are faced to more and more numerous extreme climate events, and so we thought that it was important that we insist on the roles of INPHE to face to these events and the necessity to have adaptation and mitigation plans that take into account public health. And we think also of organizing a webinar on this issue. And then we have a very concrete project with EEA and the European Observatory on Climate Change and Health that will not only associate colleagues from Europe, but we try to also include all the colleagues that are motivated to work with us on this project. And that will be related to the surveillance capacities and methods used to estimate excess mortality and morbidity during heat waves, because each countries have more or less their own methods, and we thought that it was also very important to discuss and exchange experience on these different methods. So, of course, we are faced with different challenges in the upcoming months, because maybe you've seen that I talked a lot about European involvement of European colleagues and partners. So we need to be more active in other regions of the world, and we need to keep the committee active and so enlarge the participation. It's very important for us to have some regional relay on the action we have through this committee. Then we need also, in the same spirit, to broaden to other regions the external partners' commitments, because so far this external commitment is really focused once again on Europe. And then my dream would be to find some fundings to organize in-person meetings, because so far we just had some teams meetings, which is not really easy to know each other and build a project together. Anyway, thank you for coming today and listening to my talk, and you are really welcome, you or your colleagues from NPHEs, to join the committee. And if you're interested, if you have any other questions, then do not hesitate to contact myself or Paul. And I take this opportunity also to thank Paul Coltaz from IANPHI, and also Amandine Ballard as well from IANPHI, who give me a strong support to the chairing of the committee. And thank you very much for your attention.
Thank you very much, Dr. Sebastian, for sharing with us the brilliant work that the committee have been doing. We have now a few minutes for one or two interventions from the audience. No? Yes, please. You need a microphone?
I'm just picking up from Sebastian's excellent presentation on health and environment and climate. I think there is a need for a bit of consistency in some public health standards and development. Why I say that is, this morning the minister was very clear. We have the COVID outbreak. Today we are facing a major cholera outbreak in South and Eastern Africa. And we are actually in the middle of a pandemic of cholera, although some global surveillance is very poor. These are related to environment and climate. COVID changes. Right now we have an outbreak of COVID in the Northern Hemisphere. And we will have that COVID again, together with influenza and other respiratory infections coming south with the migration and travel. So that is due to climatic factors, the change in temperature, humidity in the Northern Hemisphere and Southern Hemisphere, which happens seasonally. The same thing with cholera. It's also a seasonal disease in countries like Mozambique or Zambia or Malawi or even in other parts of the world. So I think when we talk about climate, we need to focus on the environment. And environmental health, which is one of the backbones of public health. It's a thematic area of public health, environmental health. And if you look back even historically in Europe, cholera, plague, and all those diseases came with migration and with, so I'm just appealing that when we talk about climate, we need to also talk about environmental health and also bring the infectious diseases and be consistent in our work on respiratory infections like COVID or on cholera and diarrheal diseases so that we don't miss and wait for the next outbreak and then we just manage the endemic problem and we only respond when anybody in the public can see we have a public health problem. Thank you, Madam Chair.
Thank you so much for your intervention. I wonder if, Sebastian, would you like to comment on this or anyone from the committee?
Yeah, thank you very much. I totally agree with the intervention because I think that actually, and we insisted on the roadmap of the fact that climate, environment, biodiversity were totally linked together. And so I totally agree with what you said. And I would say also that, as you said, I think it's also a matter of organization inside our own organizations because for instance, in Santé Publique France, there's the French National Public Health Institute, and I know that it's the same in other public health institutes. Environmental health is separated from infectious disease departments, whereas it's a really integrated thematics. So we need also to think about our own organization and then to advocate so that we indeed integrate for the best answers these different aspects of environmental health, infectious disease, and quality of our environment.
Thank you so much, Sebastian. I think I saw one hand from the participants that are online. Can you please confirm, Paul? It's Dr.
Yes,
Felix.
indeed, Felix.
Dr. Felix, good afternoon.
Good afternoon, everybody, and particularly yourself. I'm so glad to see you. Well, first of all, congratulations on the committee and on the work. I wanted just to make a very short comment on the role of primary health care and the importance of having the National Institutes of Public Health working closer at local territorial levels with the primary health care, because at the local level, primary health care in contact with the communities can have a very important role in detecting local consequences of climate changes and particularly local reactions, community reactions to climate, important climate changes. I normally don't see this type of, I think, a very important link between National Institutes of Public Health and the action, the territorial local action through primary health care. Thank you.
Thank you so much, Dr. Felix, for your intervention. So again, emphasizing the need of the engagement with the community in tracking public health interventions. Thank you so much for this. We are now going to move to the experience from the member institutes. So it is my honor to invite Dr. Sonja Meyer, Senior Advisor from the Norwegian Institute of Public Health. She will present us about the INBEL project. Sonja, please.
Thank you so much. Can you hear me? Yeah, good. It's really a pleasure to be here, so thank you for the invitation. Also, thank you for the moderators and the invitation from Sebastian and Paul, and to IANPHI, and then finally, thank you to our hosts. It's been a joy to experience this beautiful place of 1,000 hills. So I guess I'm have a present, there we go. So yes, thank you for this opportunity to present this work of the INBEL project, and which is on focusing on communicating climate change and health. Okay. I'm not getting the advance. Is this on? Oh, here we go. Yeah, maybe I need to push it harder. So in this presentation, what I'm going to focus on is an overview of INBEL, because I think it's a very unique program, and I want to highlight some of those issues, and also present some material that has been developed under the INBEL umbrella, the methods that underpin it, and some of the preliminary milestones from this work. And then to leave you with 3 key takeaways that I hope have relevance to National Public Health Institutes. So what is INBEL? INBEL stands for Enhancing Belmont Research Action to Support EU Policymaking on Climate Change and Health. It's a mouthful. It's an EU Horizon 2020 funded project. It's a consortium of 17 partners in 14 countries. The Norwegian Institute of Public Health was one of these partners. My colleague Shilpa Rao was the lead of this project. But these partners are actually projects, and all of these projects focus on this nexus of climate change and health. Another interesting and unique aspect of INBEL is that it takes a very transdisciplinary approach. And in terms of the Belmont Forum, it's not optional, it's required that every applicant has to have a transdisciplinary team. So that means that this is not just an economic modeling of what's happening or a medical approach. Everybody has to have, all of these projects have many different disciplines, which I think is reflecting the climate change cross-sectoral nature of it. And then the final thing is that the research is focusing on areas in the Arctic, in Europe, East and Southern Africa, South and East Asia, and North, South, and Central America. So I think this last bullet point, I hope, really showcases the fact that climate change is now very much a global issue. It's no longer just considered in small developing states or tropical areas where there's issues of heat exposure, but now what we're seeing is wildfires in the Arctic and northern regions of Canada, et cetera. So definitely a very global challenge. So in this slide, what I wanted to point out was what are these projects? And this is a bit hard to see perhaps, but each of these are the projects under this INBEL umbrella. And so I really wanted to take note of this because I think it really demonstrates the diversity of these different projects. There's a project on Arctic community resilience to boreal environments, a project Chamna, which is on climate, heat, and maternal and neonatal health in Africa, and several others focusing on different health issues in different areas. And so I think this is one of the unique aspects of NBEL, which is that this is a consortium of projects. And as I mentioned, it has 17 partners, but many of these projects have 17 partners. So now you can see the math, and then you start to see what the challenges might be in having a project like this. But in my view, I think this is actually quite brilliant, because from a donor perspective, each of these projects has limited resources. They may get to the end of their project and run out of funds to communicate or disseminate. And now you have an NBEL project, which is coordinating all of them, and now has the ability to leverage all of these findings. And so it's not just one climate change and health issue, it's all of them. And I think there's a lot of power in that I'll come back to. So that was the textual slide, and now here we can see a slide that NBEL produced that gives it a little bit more organization. So you can start to see that NBEL categorized all of these projects into what are they looking at? These are the different climate hazards if you look into the blue box. And then you can see they're very focused on the vulnerability and vulnerability factors. And then the nexus is what the primary focus was what are these health risks that are at the focus of, or at the nexus of climate change. So then when it comes down to what does NBEL do? I think primarily they were interested in trying to expand these networks and really engage policies, to have policy engagement and really push this research into the policy arena. In addition, there was specific work deliverables that were synthesizing this data, and also a big emphasis on communication and dissemination. And so back many years ago, when this application was on the table, I was actually working on plain language summaries. And so I had this idea that it would be actually quite useful to have a plain language summary on each of these. At the time, it was 15 partners. And wouldn't that be a nice way to showcase what they did? And so I planted that seed in the application, and that seed, over a 3-year period, grew into a tree. So the work that I ended up producing, here we go, was a series, a research, we call it the NBEL Research Highlight Series, which basically summarizes all of these different projects into fact sheets that are much more manageable in terms of the information that is provided. And so if you think back to that slide of all of those different projects, you can just imagine that each one had, in one case it was, I think, over 75 publications. And so how do you make that manageable for a policy person? And so that was part of the attempt here, was to take this large amount of research and to summarize it into different thematic areas. And so when we looked at what was being researched, it came down to many different health impacts. So 8 of these research fact sheets focus on health impacts, such as heart, lung disease, heat and air pollution, a focus on vector-borne disease, on kidney disease, pregnancy and health. These are just some examples. And then some of the others, 4 of the others, really needed to highlight that climate change and health is not just a health impact, but there's many different indirect impacts that need to be highlighted. And then finally, the fact that it's not just about problems, but there's solutions. And so 2 of them feature these public health tools, mobile health tools and early warning systems. So what was the methods that underpin this madness? So first of all, the first thing that was done was to see, has this been done before? And luckily, it had not been done before. There were single fact sheets on a single issue, but I think it was really important to realize that this hadn't been done, like the broad landscape of this field hadn't been captured in a research fact sheet series. So that was good. We then identified these thematic categories. That was a little bit more doable based on the previous work in the project. Then we decided what were these important structural design elements that we needed to include. And then that followed was the synthesizing the findings. And if I correlated the size of the effort to the box, that would be the entire slide, and all of the others would be little dots. And AI did not help in this case, unfortunately. It sounds like a great job for AI, but didn't actually work. for this project. I think it could in the future. But anyways, and then finally, all of the research fact sheets were reviewed by an NBEL researcher or a principal investigator. So nothing has ever been put out that has not been rubber stamped as, yes, green light, this is, we agree with all of what you summarized. And then finally, we had a designer that sort of used their magic to make it quite beautiful. So what were the elements that we wanted to include? Well, first of all, just to make sure that it was very simple and clear, so all of the titles have a very consistent look. There's an icon bar on the right, and that is to really demonstrate that this is not just, climate change and health isn't just one issue. There are many issues. There, you can see the icons of the impact on cardiovascular health, on respiratory, on kidneys, on pregnant women. So in one look, you can sort of see these are the many different issues that are important. And then also, of course, it's important to have a visual image. So all of the fact sheets have photos or use the infographics that were done in the projects themselves. And also just to go back to the fact that we are summarizing publications, and publications don't have pictures. So I think it's important to realize that people respond to that. Now we can see this is a street, this is air pollution, and it gives people a different understanding of what the issues are. Every fact sheet has the problem statement, so it isn't just, okay, what are we doing? It's, this is directly linked to a climate change issue. We acknowledge, of course, the research group or groups that have done this research, and then summarize the key findings. In addition, we highlight the implications, and one of my colleagues mentioned that this was her favorite part, and I think this is interesting because we often write our research up, but we don't necessarily reflect on it, and so these are the implications of this research, and then followed by who's most at risk, and I think that's also another important component. We follow up with a conclusion, more information, and that's really important because it's difficult to capture all of this information, so we give that opportunity to find out where can you get more information on this. And then another, we always dedicated space to the actual publications that these findings were based on. So we have the actual, the articles. So the general sort of overall aim of the impact that we were hoping to achieve was that, one, was to have this sort of snapshot overview of this is a broad issue, there's many different challenges that are being faced, and that's sort of captured in the titles and in the icons, and then also to really underscore this idea that this is research, and what we're wanting to do is take those publications that are sort of buried in Google and then lift them up into a space where other people, where the general public can understand this in language and in very clear, plain language. So we're bringing this evidence and this data to the public and to other stakeholders. And then finally, to just emphasize that this is not just text, but it's visually displaying this information. So now I'll just sort of summarize some of the takeaways that I hope that you can walk away with. And one of this is the impact on vulnerable groups. And I think that this really speaks to the equity issue that has been such a theme that IANPHI has really embraced, and many IANPHIs. And I think this is very, very important. And also, it's a theme that is very clear in climate change and health, that I think often we're thinking that a health impact is happening to somebody else, but now we can see that this is actually happening to children and newborns and pregnant women, and there are physiological reasons for this, physiological reasons why the elderly are more at risk for heat exposure because they are not as able to manage that, as well as many other issues. And we know that indigenous communities are suffering to a great extent more. Thank you. And the pre-condition pre-existing conditions are an issue. And then finally, outdoor manual workers. And I'm not going to have time to go into that, but that's a vulnerable group you don't normally see, and that's healthy young adult males who, in exerting outdoor work environments, are suffering from chronic kidney disease. Quickly on cascading consequences, that it's not just direct impacts, but indirect. When you have infrastructure damage to roads, livelihoods are dependent, farming and fishing that's going to impact food security. And then finally, a third takeaway is this idea of the power of aggregation, that this is just one of the lists of publications, and one publication might not be noticed, but in this kind of series, it's lifted through this leveraging of all of these different projects. So I think that's going back, just circling back to this idea of what is unique about NNBEL. I think it's this power of aggregation and leveraging information. And then I just have a few minutes left, so I'm going to quickly go through this. Really preliminary milestones. It's been distributed locally, regionally, globally. It's just been out a couple weeks, but happy with that. Engagement by diverse stakeholders. And I think for me, the best thing is to get positive feedback from the NBEL researchers themselves, that they were very appreciative. And that it's been picked up by the UNDRR. They've posted 2 of the fact sheets on their prevention website. And limitations, it's just NBEL research, it's in English, and I'm sure there's other limitations that I will be learning about later. And then finally, this is important, just to alert you that this is just one of the NBEL materials. The NBEL has actually produced policy briefs and videos, training courses, tools, articles, all available at nbelknowledge.eu, and I highly recommend that you look on those. And what's featured there is 2 tools. One is a Climb app. It's a mobile app for climate and health, and then one is called Hack Air. And then I think that's my final slide, so I hope I'm under my time. Just to say that this is also summarizing the NBEL materials that are available. I have written questions. I'm much more interested in your questions, and thank you for this time.
Thank you so much, Dr. Sonia, for create awareness about this important project. We have few minutes for 1 or 2 interventions. There are 2 hands there. Can someone bring the microphone, please?
Thank you very much for your presentation. My direct question, any experience of any influence of any impact of these publications into the policy making? Did it have any impact? I think if there is, this should be been included in your presentation.
So yes, that's a very important question, and I would have to defer that. I think that the answer, I think that would defer to the people that actually focused very specifically on policy briefs, and because that was done by another group, there was also there was a lot of efforts to really engage policymakers by NBEL. So they hosted conferences and other different things. But I actually, because I knew that there were already policy briefs being produced by NBEL, I had to make a clear distinction between that. And so these fact sheets are just the facts. This is the research, these are the facts, and they actually aren't offering any recommendations for policy, but that's because there is another group that was focusing on the policy. I think that these can be used for policy, but it's just more, these are now packaged into, here's all the different facts from all of this different research into these categories. Thank you for the question.
Yes, thank you very much. I'm Naif Al-Harbi from the Gulf CDC.
Mm-hmm.
Actually, I would like to read it as enable.
Yes.
If you allow that. I liked it, and it's similar to my colleague's question. Have you have any experience in supporting risk assessment to any national public health authority or any agency, or it's like a customized request for supporting a specific risk assessment on CRN in general or environmental hazard?
Yeah, unfortunately, they're just sort of so new that we haven't had a chance to sort of put them out and test them or get feedback more in terms of how they're being used. So I hope that is something that we do get feedback on. One of the challenges in developing this was the timeline, in that the timeline that I had was similar to the Belmont projects that they had. And so it was hard to, I couldn't start until they were done. And so I was waiting for them to be done. And so then this is actually just, this is hot off the presses, shall we say. So this has just been released as this body of work. So I will report back once it's been received more. Thank you.
Thanks, Mika Salminen from the Finnish National Institute for Health and Welfare. And this is maybe more a comment, but first, thanks very much for the presenters and the panelists. I think this is a crucial, actually, element on the sort of development of public health globally. And what I wanted to bring up is that we have actually, in the Finnish system, the Environmental Health Unit in the Public Health Institute is an integral part of the Health Security Department. And we have done that for the last 20 years, actually. And the interactions there are crucial, as one of the previous speaker brought up. And now we are taking the next step, because we see this as such a big issue. So in our own strategy, we are actually redefining public health as planetary health. And this is the way we want to take the evolution, because these issues that have to do with both not only mitigation but also sort of adjustment need to go through the health system, the public health system. They are very diverse. We talk here about heat, which is understandable. But for example, in the north, we struggle with increased rainfall during winters, which makes it much more slippery. And with the elderly population, we see much more injuries because of falls. So there are multiple issues. And the other part which I wanted to bring up is that we actually also have to adjust within the health system. We have lots of facilities who use a lot of energy. We could be much smarter in that. And that's also a big job to actually achieve. Thank you very much.
Yes, thank you for that. I applaud those efforts. I completely agree that, and I think what we've also tried to capture in this research fact sheet series is how much this is filtering out into other areas. And so, for example, there's one on food farming and climate change, which points out that pollinators are affected by climate change, and that there's a focus on wildfires, and so and many other diarrheal disease and the impact on flooding. So I think that it's quite comprehensive in looking at all of these different climatic impacts and the different health impacts resulting from that. So there's many challenges, and so planetary health is certainly the good approach. Thank you.
Thank you. Shelley, please. And then if there are more intervention, I would like you to request that we discuss during the break or at the end. We are a little bit out of time. Please.
I'll be quick, Sonia. Or Sophia, sorry. But Sonia, one thing that struck me while you were speaking, and also a comment about environmental health, and I think also connects to the conversation this morning around essential public health functions and workforce, is that intersectorial, the necessary approach, the intersectorial necessary approach. And CDC, I'm hot off the presses, we've developed a linkages framework that is focused on linkages between functions, among multiple functions, but also multi-level and multi-sectorial. And it really describes, with a scientific background and input from NPHI directors, how to improve those linkages and why it's important. So happy to share this with folks. I have multiple copies and also was developed in partnership with Yesser, who is here and excited about that. So just a comment.
Thank you. Thank you.
Thank you. Thank you so much for these nice discussions. And thank you, Sonia. We are now moving to the next presentation. So it will be on the German status report on climate change and health. The presentation will be done by Dr. Kristen Keller and Dr. Martin Milrich from Researcher Associates from the Unit of Health Reporting in the Robert Koch Institute.
Change in Health for Germany here. It was coordinated at the Robert Koch Institute and it was funded by the Federal Ministry of Health. We want to talk a little bit about these aspects of the report and also draw your attention to the fact that you can read the entire report and find out more about it at rki.de/climate report. So the main objective with this report was to provide a comprehensive overview of the evidence available on the various diverse impacts of climate change on health with a focus on Germany. There was a similar report published in 2010, which was entirely written within the RKI and a part of the grey literature. And this time around, we wanted to provide a peer-reviewed report written by experts from across the nation and published in English as well as German. It was also important to go beyond the synthesis of evidence and derive and communicate recommendations based on the evidence, and we'll talk a little bit more about those recommendations later. As you may have seen on the previous slide, there was about 100 authors involved from about 30 national institutions. Partly they came from agencies attached to federal ministries, as you can see here, various different sectors as well. The authors also, of course, came from research institutions in medical and scientific institutions and some NGOs. And this intersectoral effort was also reflected in the editorial to the report, which was jointly written by the heads of the 11 government agencies involved, and has the message that we all need to work together to counter the effects of climate change. The report was published as a three-part series in the RKI-run Journal of Health Monitoring, which is a peer-reviewed journal index on Medline and as a rule published in English and German. And it was divided into three parts, in total made up of 14 review articles, grouped by the topics that you can see here. The first part focusing on the impact of climate change on infectious diseases and antimicrobial resistance. The second one focused on the impact of climate change on non-communicable diseases and mental health. And the third one focusing on cross-cutting issues, again, which we'll get back to a little bit later. Now I want to give you some very brief insights into the kinds of messages that are communicated in the status report. But because of time, of course, and the nature of the complexity of the topics, I won't be able to go into it very deeply. And so I just wanted to remind you that you can read the entire articles at this URL. So for the first issue, for the first part, on infectious diseases, there is an article about waterborne infections and intoxications, and the fact that these are expected to increase due to climate change. Now, one of the contributing factors is the fact that the surface temperature of the Baltic Sea is expected to increase by 3 to 4 degrees by the end of the century. And this is very good news for non-cholera Vibrio, which like to multiply, especially above 20 degrees. And it is already noticeable that currently in very hot summers, when the temperature of 20 degrees is reached more often, water temperature, then we are experiencing more NCV infections, potentially mostly through wound infections, which can also lead to sepsis, and deaths have been recorded from this. From The second part on NCDs, there was an article on allergic diseases. Climate change influences the occurrence, frequency, and severity of allergic diseases, and it does this, for example, by changing the timing of the pollen season, or and the trend being the pollen season is extended and starts earlier in the year. It also increases the spectrum of allergenic pollen, and in Germany, most significantly, climate change promotes the growth of the common ragweed with its highly allergenic pollen, and sensitization to these pollen is expected to increase to 25% in Germany in the next few decades. I mentioned cross-cutting issues. One of them is, of course, climate justice. And there's a very interesting article on this, but I will not go into that today because I wanted to highlight the article on barriers and strategies related to communication of climate change and health topics. And one statement from this article, which is relevant to us as a public health agency, was that many different groups of people, regardless of their readiness to act or their socio-demographic characteristics, consider health authority websites an important source of information when they seek information on climate change and health. But they do not use them very often. And there's perhaps an interesting avenue for action for health authorities. The final article discusses the different recommendations that were spoken by the authors of the preceding articles based on the evidence. When it comes specifically about adaptation measures to the impact of climate change on health, and it groups these into clusters and combines them into options for action. And at this point, I will hand you over to my colleague Martin, who's actually the lead author of this article and can tell you a little bit more about them.
Yeah, thanks, Kirsten, and thanks also from my side again to IANPHI for giving us the opportunity to present the German status report of the RKI on climate change and health here in Kigali. As Kirsten mentioned, the individual contributions from the RKI status report have formulated some fine-grained recommendations and cost-effective strategies for their specific field of actions. So, for instance, in terms of heat, UV radiation, waterborne diseases, or mental health, for instance. However, our objectives were also to kind of synthesize some options for actions formulated in the report and to combine them in certain clusters that are depicted here, and guiding principles that are also based on the essential public health functions, and to address the success factors for practical implementation, and to combine these options for actions into certain target parameters for the public health context in Germany. So therefore, options for actions from the individual contributions of the status report were coded with a qualitative approach and categorized. In total, we had 236 recommendations. And what you can see here in this chart at the left is a figure that depicts the topical clusters in the area of infectious diseases and AMR, and at the right in the area of NCDs and mental health. And as depicted in figure 2 on the left, contributions on infectious diseases and AMR tend to prioritize rather informations, primarily medical informations, if you think about physicians, but also larger communication and education needs with 32% in total. Whereas the articles on NCDs and mental health, which you can see on the right side of this figure, focus more strongly on structural and behavioral prevention, so a balanced approach between structural and behavioral prevention with 34%. This includes also the municipal setting in Germany, which is primarily responsible for implementing health service, for instance. But this includes also in our German context, but I think this holds also for your countries, many of your countries, municipal heat health action plans, for instance, and also climate adaptation and mitigation through diverse measures in the field of urban health planning. Obviously, recommendations on monitoring and surveillance, including digital technologies. We heard this morning a lot about, in the last session, a lot about AI. So this is also mentioned in the status report, for instance, with regards to imaging tools and early warning systems. And overall, there's basically a further need for further research. This is giving a high priority, for example, if you think about the effects of climate change on the combined effects of air pollutants and temperatures, but also in the field of vectors, for instance, and mental health. In a second step, we somehow tried to derive target parameters and main take-home messages for the decision makers in Germany. And here, the aspect of governance is obviously highly important. This points out to the necessity for development of legal frameworks for a balanced and coordinated prevention approach between structural and behavior prevention, which is in line with the well-known health and all policies approach you're all familiar with. And in Germany, for instance, the public health service laws of each federal state are unfortunately not sensitive when it comes to the aspect of climate change. And if such strategies or policies are absent, behavioral prevention is hardly sufficiently supported, as we all know. And this we also know from other fields, public health, such as tobacco control or HIV prevention. But it is a strong consensus of the status report that both climate change adaptation and mitigation measures can be only implemented with a health and all policies approach across all different sectors. And here primarily the health, the environmental and the urban planning sector, they are key. But for implementing this, we all know, as well as for monitoring and surveillance efforts or activities, for instance, in the field of developing indicators on climate change and health inequalities, so the equity issue, which was already also mentioned in previous talks, provision of human and financial resources are a precondition. And finally, Kirsten mentioned the communication article, evidence-based target group orientated education, information and communication measures are also needed. Not only in the digital channel, if you think about websites or health information systems via dashboards, but also to ensure face-to-face participation of the most affected and marginalized groups in our societies, and also actually those ones who actually perform the implementation in diverse settings at the local level. In a last step, we also formulated, based on the options for actions and key insights from international literature, some beneficial success factors for implementation. But due to time, I just want to highlight one important aspect here, which touches the issue of dealing proactively with conflicting goals, diverse resistance, and dealing with potential trade-off effects. So if we want, for instance, cross-sectional co-benefit approach to become a reality, various stakeholders, not only from science and civil society, but also from politics, administration, and actually also businesses and corporations need to be involved to reach consensus and a common goal. And very practically speaking, if you think of one example, if you want, for instance, to establish more blue and green spaces in your municipality, which is also a recommendation in our report for the sake of climate adaptation, you also have to consider certain trade-offs that occur, such as the occurrence of potential reservoirs for mosquitoes. That is why participatory negotiation processes across different sectors, if you think about multi-sectorality, are important, but obviously also challenging as they are consuming, and so transformation here is not an easy one-way road. At the end of our talk, maybe just next slide, we wanted to report you briefly about our communication strategy, which also somehow is a nice connection to the NBEL talk we heard in the previous presentation. What are our main target groups and means of communication at the RKI, and what have we applied? It is important to note that the Robert Koch Institute has a strong focus on the scientific community on the one hand, but also the public health service sector in Germany and their decision makers at the subnational level. We believe that the scientific community was pretty well reached by our Journal of Health monitoring and our communication efforts on our social media platforms. For instance, for each of the 3 parts of the status report, short explanatory videos were produced. So far in German, we are considering also to translate them into English, but this is also a matter of resources and funds. In cooperation with our partner institute, the Federal Center for Health Education, the BZGA, we carried out also several online expert consultations, and with the website Human Health Climate of the BZGA, we're also trying to cover vulnerable groups such as elderly people, women, young children, and outdoor workers. But I mentioned these kind of expert consultations we carried out with roughly 300 local authorities in cooperation with our project partner, the Center for Planetary Health Policy, which is a Berlin-based think tank. And here we just focus basically on relevant topics from the status report, but we also wanted to discuss good or worst practices from municipalities in Germany and to give the opportunity for potential refinement of our options for actions. And we performed also an online survey afterwards to provide evaluation and feedback of the experts. And what we found out was that also in line with our options for action, that there's a strong need in terms of governance to clarify responsibilities and to provide a legal basis for federal states and municipalities, as you see in the top. However, in Germany, recently the Federal Ministry of Health, in last July, they have passed a nationwide heat protection plan. So first steps have been taken. Furthermore, which you can see with 64%, the aspect of evidence-based information on the effectiveness of measures such as heat protection plans, for instance, are also needed, and guidelines as well as good practice cases of local authorities. We also asked our respondents and attendees from the online expert consultations which resources would be most useful for their work. Obviously, a digital health information system is important nowadays, and also a short, valid information system is important, for instance, in the shape of 1 or 2 pager fact sheets, as we also heard in the ANBEL talk. This is supported here by 80%, or dashboards. However, again, practical exchange and information events on good and worst practices are considered as useful by 75% here from the health service sector. Next slide, please, Kirsten. We also asked which aspects of your work are currently very important or most significant. Not very surprising to you and to us, you can see that heat or changes in temperature at the top of this chart with 70% rating. It is very important is on the top. Heat is also in political terms the main focus currently in Germany so far. Next to UV radiation, which is here rather at the bottom with 39%. Allergens, pollens, and vectors. And here in our survey, 1 out of 2 persons also said that vector-borne diseases are their main current focus. And in Germany, we are here mostly talking about ticks, and in some rather rarely cases, also tiger mosquitoes. But what's rather surprised us here was that cross-cutting issues, such as how to communicate about climate change without triggering reactants or so-called climate fatigue, and how to implement climate-sensitive health measures in a socially just way. So the issue of climate justice are also strongly focused, and this supported also kind of our decision to include specific chapters on communication and climate justice into the final third part of the status report. And so what's next? Last slide. First of all, we would like to develop our network of roughly 100 authors and experts. This will be a main task in the upcoming period. Second, we are at the RKI in our Department for Health Monitoring, working on indicators regarding climate change and health, but also the environment and health. And this year starting, there will be a new RKI health panel, which is also supported by the Federal Ministry of Health. And finally, we are also looking at neighboring or other countries who are publishing similar reports. What can we learn from them? We know the landmark report from the CDC from 2018. The UK Health Service Agency published last year a very similar report to ours. And we're also looking to our Dutch neighbors, for instance. They have a pretty inspiring health information systems. But yeah, I think the list can go on and on. There are many inspiring examples. And finally, we would like to thank you for your attention again and giving us the opportunity. Hope this is a report from Germany, which has rather a German focus. It's also useful for your countries as well. And we are wishing you a fruitful and inspiring conference in Kigali. And if you're interested in the Robert Koch Open Access Status Report, you can easily check it out on our website, rki.de/climate report, or just get in touch with us by email climatehealth@rki.de. Thank you.
Thank you so much, both. Because we are out of time, unfortunately, we won't be taking questions. Please make note of your questions, and if we have few minutes, then we can start the discussion. We are now moving to the next member institute. We are going to listen the experience from India. So Dr. Akash Srivastava Additional Director and the Head of the National Program on Climate Change and Human Health, and Dr. Purvi Patel, Senior Consultant of the National Program on Climate Change and Human Health in the National Center of Disease Control in India, will be talking to us about the organization and experiences in planning and implementing work related to climate change and public health in India at the National Center for Disease Control. Dr. Hakash, we can see your slides.
Thank you. I hope my slides are visible. Dr. Akash Srivastava and Dr. Purvi Patel, we are from the Center for the Climate Change and Health, the National Center for Disease Control, which is the NPHI from India. And thank you to the organizers for providing us this opportunity to present our work about the experiences of implementing climate change and public health in India. In the picture above, you can see that's the photograph from outside of our institute. That's the Union Minister of Health releasing the national guidelines for heat and health for the country. So in India, the climate change is under the purview of the Prime Minister's Council of Climate Change. In the year 2008-9, this council established 8 missions. However, a new mission on health was only proposed in 2014 and 15. To begin with, a national expert group came together to deliberate on what would be required to be done, and a national action plan draft was prepared. And it was decided that we should have a national health program on climate change and human health, which came into being in the year 2019. The goal of this national health program was to reduce morbidity, mortality, injuries, and health vulnerability to climate variability and extreme weather events, with the key objectives of promoting general awareness in the public, building the capacity of the health workforce, strengthening the health sector preparedness, collaborating with partner organizations, and steering research on health and climate change. So slide presents what the key objectives were. The first one was about generating awareness, which is largely related to developing materials of IEC and providing a dissemination of these materials across the country, developing health advisories which provide guidelines of what needs to be done to the state governments, which in cascading manner is passed down to the district governments and to the local governments. The next key objective is building the capacity of the health workforce, which essentially means developing training content and guidelines for the health workforce and organizing trainings for them. It also means organizing knowledge workshops so that they can go and have field experiences of good practices. We are also trying to work with the medical councils so as to include climate change education in the medical education at the undergraduate and postgraduate level, in allopathic systems of medicine, in dental sciences, in nursing sciences, and also in Indian systems of medicine. The third objective is strengthening health sector preparedness, which essentially means helping the states to prepare their state-level health adaptation plans related to climate-sensitive conditions specific for their states, putting in place vulnerability assessments. We already have 2 national-level vulnerability assessment plans for India, putting in place enhanced surveillance systems. A lot of infectious diseases and non-communicable diseases surveillance have already been existing in this country, but with climate change coming in place, we have introduced an air pollution-related illnesses surveillance and a heat-related illnesses and death surveillance now as new 2 surveillance systems, providing opportunity for health facility preparedness and also for green and climate resilient measures in healthcare infrastructure, and then measures for early warning alerts and response systems related to climate change impacts. In the next objective, that is collaborating partnership, we have a very senior level uh, steering committee, which is co-chaired by the Ministry of Environment and the Ministry of Health, and representative from relevant important ministries to deliberate important matters that need to be jointly addressed. We also work with the other existing missions in climate change, the National Health Program, and other UN and international organizations. Indian Council of Medical Research is the national organization that works on medical research, and it's primarily we work with them to steer research on climate sensitive diseases. This is the organizational framework we have, that the central level is the Ministry of Health, and the NPHI, the National Center for Disease Control, hosts the technical unit for the National Program on Climate Change and Human Health, and we work together with the ministries, with the mission, the health program, the specific academic body which have been identified as centers of excellence, and other organizations. At the state level, there is a state level program office in the Department of Health. There is a multi-sectoral task force under a senior administrator that looks into positioning of important questions where different partners on different sectors can contribute. There is a governing body for policy decisions at the level of the state's health minister on the chair. And at the district level, we have a district program officer, and there is also a district level task force with a senior district level administrator and representative of health and non-health sectors at the district level. Among the climate sensitive illnesses and health issues, on the left-hand side are the one that we are presently working on in this center. Then this is heat-related illness, air pollution, green climate resilient healthcare infrastructure, extreme weather events. As I said, in the same NPHI, we have different departments that relates to vector-borne diseases, to waterborne diseases, and to issues like infectious diseases, AMR, and all of that. But all of that will be coming on to the next stage after we've gone through these new areas that we have identified to work in the center. As I was mentioning about, one of the important actions that we have is to work at the state level and enable them, being India being a vast country with different climatic zones in the same country. So these are some screenshots of how state level action plans have been developed. And we've already been able to have 34 of the 36 states to put in their state action plan. And I'm moving on to the next administrative level, that is the district level administrative plans on climate change and health. And then we will be trying to go down further to the local governments at both rural and urban local bodies to facilitate them to take their own decisions in their own bodies. And these task force just help them of engagement of both health and non-health sectors together. And this surveillance system that we have tried to strengthen runs across all these levels. And these health facilities are both in the rural and in the urban sectors, which are taken care of by the state governments and the district governments. That was some of the adaptation activities, and we're also concerned about the mitigation activities related to health sector institutions, and therefore we are working with the health care infrastructure, providing opportunities of making them resilient in terms of energy and in terms of water, and also providing opportunities for measures that makes them sustainable and more green. We recently completed our National Hospital Energy Consumption Survey to understand what is the consumption in both private and public hospitals, using a sample of both around 600 plus hospitals across the country. And then working with other sectors, health, as we understand, it's something that not the Ministry of Health alone can able to work on, because there's so much of health which relates to climate change, which is beyond the administrative purview of the Ministry of Health, to which the support. So we work with other departments such as the Indian Meteorological Department, the Disaster Management Authority, the Pollution Control Board, the Solar Energy Institution, the Ministry of Environment, Forest and Climate Change to be able to come to decisions and provide them resources when it comes to action beyond the health infrastructure, health workforce, and health institutions. With some of the guidelines and resources that we have recently developed in regards to climate change and health from our own center. And I'm going to speak of some specific models in each of the thematic areas that we've worked on. This one relates to the work that's being done in the state of Gujarat in relations to heat. Ahmedabad has been appreciated for one of the good heat action plans that were brought up by the Municipal Corporation of Ahmedabad, where they were able to place temperature mortality-based early warning action thresholds. And there was a multi-sectoral engagement in this corporation, and sectors beyond health participated in execution of these heat action plan. They work towards health facility preparedness, putting in place heat stroke rooms and heat illness wards, and developing ORS corners in small health facilities of their city. And the state of Gujarat has the highest, almost 90% of the health facilities of the state report under the new heat surveillance that we have put in place. And there is a lot of work that's been done in regards to community awareness and support measures in this state. Similarly, another state that is the southern end of the country is Kerala, which worked towards climate vulnerability assessment-based retrofitting and rebuilding of health facilities. There were very bad floods in the districts of Wayanad in 2018. Following that, they have worked with their health infrastructure, put in place structural measures such as good integrated compound walls, raising the buildings and putting in new floors, putting in multi-hazards preparedness plans, critical storage and inverters and medical supplies it can be shifted up, along with record to the higher flows, putting in place early warning system. This is an example of this metropolitan city of Delhi, from where we introduced the new outdoor air disease surveillance system. And in this, since started in 2017 with around 6 government hospitals, we tried to put in this place so that the local government could make use of their own data to understand relationship between air pollution and the disease. And as we see that in the emergency footfall of the respiratory illnesses, there was a 10-unit rise in AQI, resulting in 1.5 degree rise in acute respiratory emergency, not only on the same days, but with 6 days lag. And the similar findings were also found in relation to PM10, not only for acute respiratory emergency, but also for the interventions, whether nebulizations or others that were done in these centers. But these were some of the work that we strive to show of the recent work that we have done, and thank you.
Thank you so much, Dr. Hakash, for sharing the experience from India. Unfortunately, we have no time. We are really over time, so we won't have time for questions, comments. Please, if you have any, Dr. Hakash, can you please share your email in the message from the teams, and the same for Dr. Kristen and Martin. Please share your emails so the participants can interact with you. Thank you so much. We are now moving to the end. I will invite again Dr. Sebastian. Dr. Sebastian, can you please make the closing remarks in 2 minutes?
Yes, thank you. I will be very short because I know that we are late.
So first of all, thanks to all the brilliant speakers today, because I was very glad that under the umbrella of the committee of IANPHI, we can see all these activities. And I think we are really all concerned, even if we come from different places around the world, we are often all concerned about these issues on climate change and health. And I think you were speaking about a family, and that's really, I think, what we are. Now, I should say, and the presenters insisted on the fact that we are really faced to different challenges, and so we have a lot of work to do to solve these challenges. I think there's a first challenge which is the inside INPHI's challenge, I would say. How are we organized inside our own organization to tackle this climate change issue, because we've seen that a lot of essential public health functions that we have can answer to the challenge, but we need to be organized to do such. So it's first challenge, I would say. And then we've seen also that this issue was very complex, because connected to the different aspects of the public health. So of course we mentioned the fact that climate change could not be connected to more brighter, more largest environmental issues, but also infectious disease, prevention, inequities and inequalities. And so I think that we need to find also the good way to communicate with all the actors inside the public health sector, but also outside the public health sector, that first to allow first to understand the issues, and of course to act to improve the public health regarding this climate change issues. And I found that the different speakers and presenters today and presentations were really online with these different challenges, and so hopefully that we will go on with the work inside the committee. So, and once again, I would like to invite you to join the committee, because I think that we are expecting more people to do more work, because we see that this work is really amazing. So thank you very much, because I think that we have a very good dynamic, and so I also available to answer to your question after the session. Thank you.
Thank you so much, Dr. Sebastian. Before we close, Dr. Hamir, he would like to leave a message for the group.
Thank you so much. As we have been hearing since morning about collaboration, and in one of the presentations just now, together we can do it. I think I couldn't stop myself contemplating with few verses, and as you're leaving, it's a message from IANPHI side that hold the hand. Hold the hand, whether black, brown, yellow, or white. Whether black, brown, yellow, or white, and please hold it tight. Only together we can fight. And deep down in the dark night, we need to provide that light that can show the mind and the clarity of sight. And that is the actual might. Thank you so much.
Thank you so much. There is this African proverb that says that if you want to go fast, you go alone, and if you want to go far, we go together. Thank you so much. So there is one more session today. So we are done. Thank you so much.
But don't panic. It's very brief, a brief session. So one of the key products of these meetings is a statement to reflect the discussions that we've had during the meeting. And last year we had the Stockholm Statement, which was a very important statement. It reflected on the conflict and the many other challenges faced by the public health community. And that was a powerful statement. It's very useful for advocacy. and therefore we wanted to have a Kigali statement. So a team has been working, sort of led by the team from Kigali, from the Biomedical Center, with some other members of national public health institutions to look at the agenda and to draft an initial suggested statement which covers the issues that we will be discussing. So I think what we were going to project it, but rather than looking at it in detail now, there will be an opportunity for people to consider at a more leisurely pace the statement and its contents. But what I can do is just break down the various paragraphs that have been included in order to help you work your way through why we have said what we have. So if we can scroll down a little bit, so that, and there are already some modifications to this. So the very first paragraph is the setting. So just noting that we are here in sort of Kigali, hosted by the Biomedical Center, and our objectives are to build public health, advance public health, resilience and sustainability. The second paragraph is noting that we're at this decision point with the COVID pandemic funding waning, but the opportunity to sort of act now to build back better being incredibly important. And we reference the essential public health functions document that we discussed in session 2, and we've heard various comments that a key role of national public health institutions is to ensure the delivery of essential public health functions. So we reference that document and put a link in to access them. The next paragraph really deals with the fact that this meeting is taking place on the African continent. We have heard from WHO and from Africa CDC, and we've seen the very strong leadership of Africa in championing the development of national public health institutions. And we wanted to reflect that African leadership as being important in building that capability. So there's a strong reference to that, but also reference to some of the core themes that we need this in order to address and promote equity and acknowledge the roles of the key partners. We then have the next paragraph. We talk specifically about some of the agenda items we're going to discuss tomorrow, which will include the need to develop to address future threats, including the growing burden of non-communicable disease, because a lot of our discussions today has focused on communicable disease, but national public health institutions in many countries also deal with non-communicable disease, and we wanted to capture the fact that we have that broader, or many institutions have that broader responsibility. We then have a paragraph which reflects on the WHO statement, which included references to comments and support from Dr. Tedros, the Director General of WHO. So the partnership signed between IANPHI and WHO is incredibly important. The collaboration that we have with WHO helps all of us further our collective agenda, and so that's an important reference. We will also have some very good words from Dr. Sabine from the Minister's comments this morning, which we will incorporate into the statement, so that we have those high-level commitments from the international level, but also from the political level nationally, with the Minister of Health stating his commitment to this shared agenda. We then go on to some of the specific commitments, which are areas that we will be debating throughout the meeting. So we will talk about the centrality of national public health institutions in advancing public health. We had a session about artificial intelligence, but we will talk and reference more broadly the importance of utilizing advances in technology, but also assessing and appraising their utility. That technology assessment is important, but also in ensuring that there's greater equity and access to technology, recognizing the challenges we faced with global inequity and access to vaccines and diagnostics. We need to make a statement that calls for greater equity and access. We then have a statement which commits us to delivering the full range of the essential public health functions, and also the references made by Kasum Diallo this morning to the roadmap to develop the public health workforce. So seeing that synergy between institutions and the workforce that staff those institutions, and committing to work to support strengthening of both institutions and workforce capability to deliver the essential public health functions. And then we move on to some of the discussions we're going to pick up on tomorrow around collaborative surveillance and the international architecture that's being developed to support that. So acknowledging some of the global mobilization of funding that has occurred, but trying to make sure that we benefit and ensure that all countries can access that and utilize that resource effectively. And finally, we end with, again, strong references to the fact that we need to act collectively, making reference to the session we've just had on climate change, environmental degradation, and our need for collective action. So that we have a strong statement on the importance that we act collaboratively, and that acting together is vitally important. And then we wanted, because we haven't discussed it specifically, just to further endorse the Stockholm Statement. So we're not going to debate all of these things now. There's an opportunity, hopefully, for you to read through and see whether you agree with the sentiments expressed. We don't want to embark in those all-night crafting sessions that those who attend the World Health Assembly do, wordsmithing a document. It's the broad principles that we want to engage in. But hopefully by the end of this meeting, we will have discussed and debated all of these issues, and there will be opportunity for us to collectively commit to the principles are set out in the statement. So hopefully that will be a useful product from the meeting, and there will be opportunity for you to help shape it further. And finally, I just want to hand over to Duncan, who's going to let us know about the important arrangements for this evening, I think.
Well, thank you, Neil. That's easy. 6:45 p.m. in the main reception. This is a gift from the Rwanda Biomedical Centre. Big thank you to Prof. Claude, his team, and we'll have an enjoyable evening. But not so enjoyable that you won't be here tomorrow and ready for another full day. Thank you everyone for being so involved today, and see you at 6:45. Thank you.
And things like heaven